And they're not going to just place the levels of respect just because you've got the badge that says you're the boss.
Yeah.
That doesn't resonate with them. They want to feel relationally that you've invested and that you're also in the trenches with them, that you don't just hands off, that you actually lead by example. That's what gives credibility in the leadership space for our Gen Zs.
I'm Dr. Louise Massara, and this is the Future Health Podcast. Generation Z is characterised by their innate fluency in technology and a strong sense of social responsibility. As employees, they're already beginning to reshape the healthcare workforce with their digital acumen, creativity, and passion for efficiency. With a knack for leveraging social media, data analytics, and emerging technologies, Gen Z is likely to be a driving force in the adoption of new tools and methodologies in healthcare delivery. As patients, Gen Z are also starting to redefine expectations in healthcare. Generational expert Claire Madden joins us to lead a conversation as we look to unlock the potential of Generation Z as changemakers who might just revolutionise the health system. Dr. Claire Madden is a leading voice internationally on Gen Z. She's an author, social researcher, keynote speaker, and media commentator. Welcome, Claire. Deciding to be a generational expert's one thing, but you've focused in on Gen Z. What about the generation sort of attracted you to a study of who these people are?
Yeah, I think what's interesting about Generation Z, particularly at the moment, is that they are the really emerging cohort through our schools and into our workforce. And so I guess I've been tracking them for a number of years. They've seen so much disruption in their short lives because of the rapid technological change, the social media world and things, which has transformed how that generation connect, how they relate, how they work. And all these things happening at a young point in their life has shaped a different worldview for them. So that I've just found them extremely fascinating. It's easy to get frustrated by different generations. You think, gosh, they're lazy or they're this or they're that. But actually, there's so much more going on for them when you scratch beneath the surface.
Tell us a little bit about some of the specific attributes or qualities that we might associate with Gen Z.
Well,
Gen Z or Gen Z? I keep going.
Yeah, either. I mean, Australia sort of goes Gen Z, but other places Z. But attribute-wise, I think Gen Z are often known as being tech savvy. Yeah. Now, obviously, their skills in technology will vary, but technology is infused into basically most of the waking moments of their lives and the global connectivity that's come from that. So they're the most global youth culture that we've ever seen before. So when you think about kids all around the world, or not just kids now, they're young adults, sharing the same media platforms, following the same celebrities, sharing the same content, creating their own global youth language. So they're more globally connected and informed than we've ever seen before. The influences shaping who they are far more diverse in that respect. So there's many things that flow from that. One is that they love then collaborating. They love having a voice. They've had one from a really young age. You think about even the encyclopedias they've grown up with compared to what we grew up with. So we had, Britannica.
The World Book.
The World Book in the library, and you'd get the volume out for 10 minutes, write down what you needed. They're growing up with like the Wikipedias, which are not just, one's print and one's digital, but they can actually change the global encyclopedia themselves. And so they're used to collaborating and really being involved at a young age. And I think when you start to see the flow-on effect of these trends, that's just really interesting.
So outside of that technology and global connection, are there other influences that have really shaped the values of this group?
Yeah, I'd say that it's hard to remove technology from so much of their world, but one of the things that we see strongly with our Gen Zs is their desire for social and relational connection and the priority they place on that. So they're quite tribal and connected, but whilst they're spending hours connecting online, they're actually longing for face-to-face and for offline community. They don't necessarily know how to facilitate it, and there's massive gaps in many of their lives around that space, but they place a really high priority on that aspect of life.
So that's so interesting, because in other conversations we've had in this season, we've all sort of been looking to the younger generation as these real embraces of virtual health and technology in health. And while there may be an element of that, it's maybe we're underestimating the generation's desire for that piece of humanity and the the hand on the arm and the face-to-face connection. So we might be misthinking that.
Yeah, I think it's easy to assume because they default to digital and because they'll default to screen-mediated communication in any opportunity. It's like I'll send a text rather than call that person, and I'll send an email rather than, something that might be slower. But it doesn't mean it's satisfying them and the need for, like you say, the human side of them. And I think that we can assume that, they'll just want the digital version. And yes, they want flexibility in how they live life and they value convenience. If there's a faster way, they'll probably jump at it. But at the same time, they're saying, hey, we're connected, but we're lonely. And we're seeing higher rates of loneliness amongst Gen Zs than other generations and things like that. And so I think what we're seeing is a longing that they have for human interaction, face-to-face, real community. They don't necessarily know how to facilitate that, but even patient relationships and things like that, those offline ones can be very impacting for this generation.
I'll come back to them as patients, but I want to start with thinking about our new team members in health. We've got a workforce that probably spans as much as anywhere. Although I think I talked to someone who told me no, Bunnings has a bigger span. I think they've got some 90-year-olds at Bunnings. But we would regularly have people straight as school leavers all the way through into well into their 70s and some in their 80s. So we've got that real multi-generational experience, and we work in teams. We don't work as in silos or solo practitioners. So it's an interesting melting pot of ideas, values, ways of thinking about work. And as an employer, managing all of those generations, very different ideas around what motivates people, what flexibility means to different groups, what career opportunities people are looking for. So let's sort of work through. If we're trying to lead and inspire Gen Zs, what do we need to know? What should we be targeting?
Yeah, it's a great question, and you're right. In it's such a diverse, multi-generational workforce, you've got your work cut out for you as a leader or as a manager, because what might motivate our baby boomers can look quite different to our Gen Zs. Some themes for motivating from a leadership perspective for Gen Zs are that they love approachable leaders. They say that, again, that relational theme comes through. So they want to feel like they can go up and talk to their boss, their manager, their shift leader, whoever it might be, and that they're not off far away in a lofty office or unreachable relationally. And again, they've had access to flatter structures in the online world, and so they expect that in the workplace. They don't want a boss that they can't relate to, they can't talk to, they can't approach or ask questions of. They feel like they should be able to go up to them, that they're approachable, that they're friendly, that boss is interested in their development as well, and is interested in who they are as a person. So previous generations, it was, I think, more distinction between this is my professional world and my private world, and we don't mix them. But for Gen Z, it's been a real melting pot, really, of when I'm working, when I'm not. Personal and professional lives much more blurry, and so they want to feel known. They want their leader to know who they are.
I wonder if even just that working from home experience has blurred those lines. Even the physical space that we're in, its office and its bedroom, it does make the distinction difficult to identify, I suppose.
Yeah, that's right. And so that being an approachable leader, someone who takes the time to invest in them, get to know them, be interested in who they are as a person. They're not going to just place the levels of respect just because you've got the badge that says you're the boss.
Yeah.
That doesn't resonate with them. They want to feel relationally that you've invested and that you're also in the trenches with them, that you don't just hands off, that you actually lead by example. That's what gives credibility in the leadership space for our Gen Zs.
It's going to be so interesting in health because we're traditionally quite hierarchical. We sort of have an apprenticeship style model. So imagine some of our boomers and even our Gen Xers, it's going to be a real transition to accept that more collaborative approach to doing things as a team. Do you find that there are particular generations that sort of are a better fit with Gen Z?
Well, it can be a challenge, like you say, if you've worked in a sector, and many people in health have been in that sector for many years, decades, in fact. And so it's like, well, we didn't have it like that. We had to work our way up, or we
walk to school with no shoes.
That's right. Yeah. And it's true, they didn't have it like that. They didn't have these leadership styles like this or whatever else the Gen Zs want. And so it can seem a bit unfair, and it can seem like, well, why should we have to? But I think if we take a step back and realise society has changed so much, and these young people aren't trying to be annoying. This is just literally what makes them tick. If they feel motivated when they're relationally connected, and if we understand they're not trying to come at it from I'm trying to be difficult, but actually the world's shifted, and I think then, whilst closer in age generations might understand them more, all generations can. It's just a matter of taking that learning posture and going, okay, things have changed, things are different. How can I get the best out of these young staff members that I've got? And that's leaning into things like this collaborative leadership style.
Feedback's a big part of the health sort of ecosystem. We need to receive quite a bit of feedback, and we need to give feedback. And some groups of people find the feedback language quite confronting or difficult. And although there's been a lot of education and training now in how to give good feedback, how to give constructive feedback, I wonder if that's a particular area that we're really going to need to grapple with, just in using the right language to ensure that we are fundamentally encouraging and inspiring rather than perhaps ostracizing. Or I just imagine this might be a zone where we've got to get on the same page with language.
Yeah, and it can be really delicate, the whole feedback side of things. I think Gen Z are kind of known for, they don't take feedback well. And I think there's a couple of things going on. One of those is that Gen Z have grown up with a lot of constant fast feedback in their online space. And they are the first generation to navigate having a virtual identity at the same time as working out who they are offline through their adolescent years. Now, I think this has added a lot of complexity to their identity and sense of self, because there can be a real disconnect between your virtual self and your physical offline self. And you can manipulate your profile to be funnier or prettier or whatever it is to get those likes. And they will do whatever they need to do to get those followers or get those likes or get that interaction online. But they can feel like there's then a massive disconnect between who they are out there and then who they really feel like in real life. And so I think underneath the surface, whilst Gen Zs can come across very confident in certain areas, for many of them, I feel like there is a fractured sense of self. There hasn't been as much development curating who they are offline in their real life, being confident in and comfortable in that security in who they are. And so feedback then can really hurt. A little bit of feedback can be like, oh my gosh, the world is caving in here, because they're used to the positive affirmation that they can get in that online space. And then if they're already not feeling confident about who they are, it can really feel uncomfortable. So I think Gen Zs have got some work to do in that space, but we can also work out how to give feedback. And one of those ways is the good old sandwich, where you give them the nice compliment, something that they are doing well or that you're seeing growth that they're improving in, the area that they can improve, and then something to finish that's nice again. And I know that's an effort again, and I don't have time for this, I'm running a whole ward or whatever it is. But again, we are dealing with people, and it can really help build that person up. But what I've also found with Gen Z is that they do want constructive feedback. When you talk to them, they say, we want to be better at what we're doing. We don't want to just keep doing the wrong thing. We want to know that we can improve. Again, the foundation is the relationship though. So if they feel like their boss cares about who they are and then comes and says, hey, that didn't work so well, can you try like this? They're going to respond much more positively than someone coming in. The only time they seem to talk to them is to give them negative feedback.
I'm just seeing a relationship between feedback and then recognition. Yeah. And I'm thinking about what you've just said in terms of a persona that's created for likes. And then you come into a workplace environment. Is there an expectation that there's going to be, lots of pats? Or, how would an institution in real life show the likes? We're looking always for ways to recognise the contribution of our team members, the effort. These are hard jobs, big responsibility, long hours. So recognition we know it's important, but I'm wondering whether the distribution of recognition is going to have to change a little bit. An end of year award might not be the thing if what you're used to is minute to minute, response to your,
Yeah, it's trying to strike the balance, isn't it? Because we can't just have our managers all day feeling like they have to be walking around saying, great job, great job, great job, great job. And it's that there's so much to do in a workplace. But I think the key is if we can get it into the culture, that the feedback is part of the culture around here. And that's from the bosses, the managers, the leaders, yes, but it's also from co-workers that we help each other out and we're all in this together. And so when I see Sam doing something great and I'm the same level as Sam, but I say, that was fantastic how you handled that situation or that patient or that difficult moment or that, that upset person. And if it can be part of the culture where we speak well of others and where we speak well to others and we draw out the strengths in other people, I think that that's a much more healthy, balanced environment than this expectation that the boss has to go around and tell everyone all the time everything they do well.
So what are characteristics of an employer of choice for Gen Z? Is it we have a growing workload and there's a worldwide shortages in the health sector. So we're going to need to be really good at attracting this generation, being seen as somewhere they want to be a part of. How can we do that? What will they be looking for?
Yeah, I think it comes back to the culture that you're creating around the work. So in the past, again, well, I've got my job and I'm just going to work hard at that job and that's it. But actually, a job in itself is not what's going to keep our young people engaged. It needs to be a workplace culture where they feel all these factors are being met. And so some of those factors we've talked about, the approachable leadership, the supportive culture of safety and well-being. Mm-hmm. There's also desire for continual learning and development in our Gen Zs. So if they feel like I'm learning both personally and professionally here, I'm constantly growing, there's challenges, and I'm getting opportunities for training, both formally and informally. It doesn't have to just be another course. It can be your manager taking you under your wing saying, let me show you how we do this, or come into this situation with me and we'll show you. And that constant environment of learning is extremely attractive to our Gen Zs. There's also a desire that they want to feel trusted and that they have a sense of autonomy in the work that they do. So they don't like being micromanaged where it's like you have to do it this way and my way or or no other way. I think it's tricky in an area like health because there are obviously extreme processes that need to be followed. But then if we also trust them to do their job and to do it well, and you need checks and balances in to make sure we're treating all our patients correctly, but having that sense of trust is a big thing, and a sense of contribution. So if they feel like I am making a really great contribution in an area that I feel competent in, those factors all together create an environment where they think, I love my job, I'm motivated, and I'm making a difference, which obviously is not hard to show in the health sector. I think that's a real opportunity you have, that they're doing such meaningful work that is immediately changing people's lives day in, day out. And I think telling that story, showing how they're doing it, talking about how you're impacting lives is really important, not just assuming all they can see they're doing it. Yeah.
In health, career longevity has sort of been a real thing. You leave school, do some long course, and then you progress through the steps of your career pathway. Not everybody, lots of people, do other things, but I wonder whether that's an identity that's less appealing to Gen Z. Are they, as a group, do you think they're going to be looking for more experiences, breaks from career? It's not a job for life anymore. I wonder whether even institutional loyalty, that idea of sort of connection to the place, the institution, the brand. The NHS has an extraordinary relationship with the community and the workforce based around its brand and its purpose and meaning. And again, people there, you enter, you're in. How's that going to fit?
Yeah, as some Gen Zs have told me, baby boomers saw work as central to their lives, but for us, we see experience as central to our lives, and work is a part of that. So they want to be gaining experiences all the time. And if it feels like, I could get a new experience, a better experience over there, they're quite likely to jump across, even if it's not jumping up in a career move. They want enriching life experiences. And I think, though, what health sector has going for it is, like you say, there's a huge opportunity for career pathway and progression. And that's very attractive for our Gen Zs who want a sense of continual learning, growth and development.
They'll have no problem with that in
That's
health.
right. Yeah. But if we can make sure that that's explicit and that they know that there are opportunities to keep growing here, and actually you don't need to jump to the other place to get a growth experience, because the grass isn't always greener over there once they move over there. And that's why if we've got that culture thing right, I think we keep them where they are in terms of in our teams and organisations. We can keep them for a lot longer and progress them and keep that knowledge with us.
So let's think about flexibility and work-life balance. Again, we're getting better. There are more options. There are increasing opportunities. But fundamentally, at the moment, we're still a face-to-face industry and people are unwell 24/7, 7 days a week. So we don't have all the levers that some of the other industries have on offer. Given that, we've talked about the purpose and meaning. Is there something else you think health should be shining a light on, to look over here and don't worry so much about the flexibility, because we're working on it, but we're not quite there yet?
Yeah, I think it's interesting. Gen Z do talk about flexibility, but what I've heard in the research I've done is it's more about understanding I've got more going on in my life than just work. So if my leader can understand, if I've got an exam for university next week, and can I just have some flexibility around shifts this week, so that I can do less this week and study for my exam. And if there's that understanding again of the whole picture of their life, that's the flexibility I'm hearing from Gen Z more than the work-life balance, which we heard a lot from millennials. I think what health has going for it is this face-to-face side of things is actually what Gen Z are longing for, and they come alive in a great environment that's facilitating how to do relationships well. They want more face-to-face. Some research through the pandemic time showed Gen Z were the most keen to have more face-to-face interaction. And you think about it, they started their careers and the world kind of shut down, and that was very isolating for them. They want to learn from mentors from other generations. They want to be in a dynamic environment. And I think you could really leverage and talk about the strength of community that happens in the workplace in an environment where you're investing in changing communities and changing people's lives. So I think that relational side of things that you have going in a face-to-face environment like this, and a very dynamic environment, is very attractive.
When we think about the preoccupations of different generations, there's always sort of a burning issue. I suppose climate change might be a particular preoccupation for this generation. And, we see coming in through the door a lot of eco-anxiety, eco-depression, concerns from our younger adolescents. As an employer, is your position on sustainability, and that is that a critical sort of, got to tick that box, get that right? And what does sustainability mean to this generation?
Sustainability is something I talk about a fair bit, and obviously they've been very informed at a really young age about global issues, and they, as a generation, have jumped on passionately on the climate change cause and the sustainability cause, and wanting to leave the world a better place than they found it, which I think is a really positive thing. At the same time, I sometimes call them our conflicted crusaders, because our Gen Zs are in a season where they are saying, when it comes to them as consumers, they've got the highest desire for sustainable options and for all of that side of things, but then they're also buying fast fashion at the same time. And it's that kind of, they'll buy some things from the secondhand store or vintage to make sure they're ticking the sustainable box or from a sustainable brand, but then they'll buy fast fashion because of where the price point is.
Affordability, yeah.
And so I think in all of us we see these tensions between our aspirations and our reality. As employers, I think for Gen Z, if we can listen to what's important to them, hear about what causes, what values matter to them, and then work out in your departments or teams or whatever scale want to take on their causes, look at how we can do something about that and champion where that's happening. Maybe we're reducing the use of plastic, or we're reducing waste over here, or where we've moved to less paper use over here and digital platforms. Whatever it is that you are doing well, talk about it. Let them innovate too. Be open to listening to ideas from their generation. They might be thinking, why are we doing things like that? We could be doing it like this. And so having that culture where you hear from them and go, stay open to what's possible. And then, again, talk about what we're doing.
As I think everyone understands, we work in quite a protocolized system in a lot of ways, but we also work in a system that's always evolving and changing. There are new innovations. Some people would say to you every day, they're asked to change something, adopt something new, think about something in a different way. So from that perspective, I think we're primed to have a really beautiful marriage here, because it sounds like that lifelong evolution and learning is appealing. I'm wondering if we can really harness some of the qualities of Gen Z, maybe around efficiency. I wonder if they're going to have that view to disrupting the system, and because of their complex relationship with technology, but also because of, I suppose, their comfort around new technologies, they probably could lead the way in a lot of this early adoption.
Yeah, absolutely. I think that Gen Z are wired to see, is there a more convenient way to do this? Is there a more efficient way to do something? And they're probably coming into our organisations and like going, why are they doing it like this? That's so funny, or that's so archaic, or that's so slow, or we could be so much more efficient if we used an app like this or a process like that. Or you could probably walk down the corridor and ask your Gen Z staff, what could we do differently process-wise? And they would give you so many answers just straight off the top of their heads. And so I think, again, it's challenging because we're already so busy and there's so much you're trying to do in running an amazing health department. But if we can take the time to listen and create a culture where, whether you've been here for 2 days or 2 decades, we want to hear how we can improve things and get that culture of innovation at grassroots as well as, from the leadership. That will not only improve processes, but it will greatly increase a sense of ownership and buy-in from your staff who think, oh my gosh, they listened to me and we improved this whole process. I'm so invested in what we're doing here because we are creating a better health system for Australia or for wherever you are. And so definitely not being afraid to have your processes challenged and look that there could be better ways of doing things, because it might work and that's fine, but we could do something far more efficient.
I think the world loses a lot by not looking to younger people to lead. We have a lot of older people who are in leadership roles. And I wonder how we can harness the enthusiasm, the motivate. There's so many aspects of youth that really are critical to leadership. And I just wonder where there's a space and what the frustrations must be for young people when they look in a system like health at the layers above them until they really get to be sort of leader decision makers. Now, I think we're very good at health in seeking input and looking to the front line to innovate and all of those things. But the reality is, a lot of the decision makers, there's a long path. Have you seen in other industries where they've done this well and where it's been successful, where we've let younger people take charge earlier?
I think we do see it in some sectors. Some of the more tech-based sectors, they see, wow, our young people are just amazing at leading the way and how we can do things. But it's not just tech that they're great at. And I think one thing we can all do is get like a young leaders advisory team that are working alongside the top levels of leadership in an organisation, and that they're genuinely engaged to come up with ideas and to present to the board or to present to the leaders of the department and say, we've come up with an idea, this is how it could work. And really they've thought things through. It's not just, and they're presenting ideas, and it's that relationship where we're taking them seriously, because what I love about Gen Z, that if we can harness in the workplace is that they actually give us insight into the future consumer as well. They have expectations like our consumers do out there. And so if we can listen to them, we're probably removing huge amounts of frustration from all of our customers and patients out there, because we just listen to our Gen Z workforce.
It's a good transition, because I think we should move on to thinking about Gen Z as now our community, our consumers, and our patients. You know, there's a big a push to sort of population and public health really coming to the fore as we try to stave off this wave of the need for acute hospital care. It's only going to really work if we get those health messages and we see changes far further upstream. Who are the trusted voices for Gen Z? If we're going to give them a health message, if we're going to talk to them about vaping, who needs to be the voice of that message to cut through, to be heard, and to be believed?
It's a good question. I think there's probably a few layers of voices they might listen to. One group they listen to a lot is who they see as their peer community. So if you can get people who are influential in their age group or that kind of thing saying, hey, this is not good for our health. We can do better than this. Let's not go down that path as a generation. That can be very influential. But also when there's someone who, again, has the authority in an area, they might be a professor or an expert of something, but they genuinely can relate and seem to care authentically about that generation and engage with them and listen to them. And, you know, that kind of, they're looking for relationship, Gen Z. Not just someone selling me something.
So they're looking for stories rather than facts, or the interweaving of both?
Yeah, interweaving's fine, but they've been sold at so many times and they're very hesitant to just buy into messaging from an organisation. They want a relationship. And so if they feel like you are investing in them and caring about them, and you see government departments actually getting good followership, like New South Wales Police do this well. They have lots of people following them in their Facebook, and they'll put up serious messages and then they'll put up hilarious memes that even as a millennial, I'm like, what are they talking about? But I think Gen Z think it's funny. And so if we can build that relationship, we can get those important messages out.
So we know, we're all wearing stuff now that's telling us a lot more about ourselves, our health, and it's only going to progress. You know, we're going to be wearing contact lenses soon that tell us what's going on in our biochemistry, and we're going to hold so much of our own health history on our devices. But knowing things and then doing something about what you know is the age-old problem. And I wonder whether you think Gen Z is any more influenceable than the generations that have gone before?
Yeah, good question. And again, I think we've got more opportunities to talk than ever before, but we've got more noise that we're trying to cut through than ever before as well. So apparently we've got 8 seconds to get the attention of a Gen Z consumer,
right,
compared to the 12 seconds you had for your millennials. So there you go.
They wouldn't even get through one of my questions. Right?
That's right. And you think about how much time they give you when they're scrolling past an Instagram post. It's like seconds, moments. And so it's harder, I think, to get full engagement and attention and cut through. However, they're also a generation that do jump on board with causes, and things can spread virally very quickly. And if you get them talking about it to their peers, that can be very helpful and influential. There is a challenge because, like we see with how they support other causes, they sometimes say, we just don't even know what we're supposed to do. We're so overwhelmed, but we'll just sit there pressing the crying emoji.
Right.
You know, and so it can be hard to move from, okay, I know about this, to I'm going to act on it. And again, I think we just need to keep trying creative campaigns around health, well-being, getting them to take ownership over things that their generation is struggling with, mental health and things, trying to find leaders even within their generation who say we can change how we're living, or we can, change this behavior. Trying to find champions within their age group could instigate some of that.
So AI, there's a lot of talk about AI, but everything you're saying to me today, I'm starting to rethink in my mind. There are psych chatbots. There are all these potential AI sort of community and friends and companions now, which I think there's an idea that adolescents and young people are going to want this. But I don't know, it feels like they're almost going to come full circle and be like, hang on, that's not real, that's not authentic, that's not a human. What's your research tell you about the relationship or the acceptability for Gen Z for the role of AI in their lives?
Yeah, they are quickly taking up any new technology, and AI is no exception to that. So they're early adopters, many of them. They're integrating it in how they work and how they learn, how they do their school assignments. It's not uncomfortable for them to learn a new technology like AI. But like you say, technology does not replace human connection, and it never will. And yes, technology, we could get it to do all these clever things, but do you want a robot coming in to tell you you've got cancer? No, you don't, and you never will want that. You need a human to tell you when things are not good, or when you're going through difficult things. And there's something that technology will never be able to replace, in my opinion, that humanity has. And we need to work out, where can technology facilitate things, improve efficiencies? Let's leverage all that. Let's go for it, not hold back. But let's free ourselves up to then have the human connections with patients, the human connections with our staff, the human connections with our community, because I think that the more that technology invades our every waking moment and every sleeping moment, there's technology going on around us, we need more humanity. So I do think there is going to be a swing to that. I think it's needed. Our young people are crying out for it. They don't know how to necessarily facilitate it. They don't have the same interpersonal offline communication skills, for example, because they haven't sat around talking like older generations have, but they're longing for it.
So devices, technology, every day on the TV, I'm seeing parents, red alert, we need to remove technology, we need to remove the devices. The relationship between device use and mental well-being and wellness. Are young people on that journey too? Are they as worried about themselves and their well-being in relationship to these devices as parents and academics seem to be?
Yeah, many that young people I've talked to are saying, I'm shutting down this social media account or that one, or I'm trying to take time off, these devices, because I think they're coming of age and going, this is not working for me. I'm feeling stressed, frazzled, exhausted, emotionally, all in a mess from spending so much time on these devices. It's not working. But I feel for Gen Zs, because it's not their fault that they grew up in a society that gave them these devices that have no boundaries, that are constantly connected, where they are, contributing and extremely addictive. And we gave them to them at such a young age. And now we're blaming them for being addicted to these things. And so I feel for them. And I think, we actually need to look at what's healthy. Like, my grandparents' generation didn't know that smoking wasn't healthy. And now we're coming and going, actually, is all this screen use healthy? Perhaps not. Is it healthy to have your kids exposed to all this content and information and these people? Perhaps not. And so Gen Z, I think, have been our guinea pigs because of when they came of age in this technology age, and they are aware that it's not working for them, but then at the same time it's so integrated into their life they don't know life without it. So I do think it will take a while to work it out, but let's challenge. It's clear we've got more mental health issues than ever. It's clear we've got things not working for our young people. So society's broken in some areas, and we need to challenge what we've been doing to see improvements.
Do you think mental health is the fundamental health challenge for Gen Zs?
It's one that they'll talk about all the time if you ask them. Obviously, health, there are so many layers to health, but mental health is something that they are aware of, that they talk about. We see in the ABS data higher levels of psychological distress and mental health challenges for our young people. Which is terribly concerning, isn't it? When you want them to be free and happy and part of society and contributing well, and they're dealing with all these complexities. So I think let's take responsibility where we can to make a society that's healthy, let's set an example. Often older generations, we're so hooked on the technology. We're setting examples for our young kids by being on our screens instead of talking to them, that letting our screens interrupt dinner time conversations. So I think we all need to reflect on our own behaviours and go, is this what we really want? And challenge that, and then help our young people by even teaching them screen off time for half an hour, for an hour, not checking your phone as the first thing you do when you wake up, getting outside. Some of the Gen Z said to me, life was better, the older ones, they said, when we got to ride bikes outside. But now we're addicted to social media and we don't know what to do. And so there's a grief in them, I think, from the days were better when we had that freedom of playing. And so let's see what we can do to bring that back.
One last area I wanted to explore is the feeling Gen Z has about their personal data. You know, older people, very crazily protective. You know, some don't even want health data shared between one practitioner and the next. And, you know, I totally understand there have been dangerous data breaches and the like. Is a generation that's grown up sharing so much about themselves online, do they have a different attitude to their own data protection? Or not?
It is interesting because they are so free at sharing so much online, and I think probably more than other generations, but then they would say that they're more aware of like what a scam text looks like or a scam email or things too, than say older generations often. So they feel a bit more savvy perhaps. Having said that, the cybercrime is such an issue these days that obviously organisations need to really work out how to keep data safe. Yeah. But I think overall Gen Z do more comfortably share than older generations, and they probably just see, it's part of life much more. Having said that, they're not completely naive. They are informed consumers. Yeah.
Claire, I think that there are so many places at which Gen Z and health are going to complement each other. We've talked about so many of them today. And I also think as our patients and consumers, I think we're going to have to really think about how the healthcare services are going to meet their needs, their expectations, and we're really going to have to tackle this question of the mental health and well-being of our young people. And as you say, all the generations play a role and have a responsibility for our young people, and that's probably our job to do right now. Claire, thanks so much for your time and your insights. And we look forward to joining up and teaming up with Gen Zs over the next 10, 20 years. Thank you.
Thanks so much.